I'd had some stiffness in my elbows. I wasn't able to do quite what I thought I could be doing. Driving aggravated it. As you think about touching the back of your head, that's not a big deal, but it is when your elbows don't work.
You may notice clumsiness, numbness that goes along with your pain. Usually they'll have x-rays first. We get a good physical exam.
That first appointment when I saw Dr. Maschke, he was a doctor that gave you confidence right away.
We just go over the different options, and usually initially that's something very conservative. Anti-inflammatories, cortisone injections, physical therapy. And if those things aren't working, then we discuss an elbow replacement.
He just seemed to know right away that it was going to need to be replaced. To get rid of the pain was not a very hard decision for me to make.
The joint is where the humerus and the ulna come together. And so we have to replace both of those. We replace the humerus with a metal implant, and that has a stem that goes up the bone, and we actually cement that inside the bone. And then the ulna is the same thing. It allows you to flex and extend, usually fully.
Woke up very easily, back in the room, and I just got very good care from the nurses.
You get a little plastic splint made by our therapist, and they teach you some very simple motion. Most of it's done at home. 6 weeks is that point we kind of say, well, use it as you want with the lifting restriction. If you're going to lift heavy with your arm, it's a huge stress to that joint. It can cause loosening and then failure of the replacement. An elbow replacement has about a 5 to 7 pound lifting restriction, and that's the number one thing that we have to really make sure patients understand.
I don't totally lift with my arms anymore. I can use my core. I realized last week I could put a hot roller in my hair for the first time in weeks. I can't say enough about the Cleveland Clinic. It's just like one big family. You can see how concerned they all are for me, the patient.
A lot of people come here because they want to go to a center where this is done often. It's a fantastic surgery. It's something that can really give you relief.
I'm not ready to sit in a chair yet. I've got a lot of living to do. Cleveland Clinic gave me back my life.